While we are waiting, I'm going to drop the pre-survey into the chat box. If you have not already done so, please take this time to complete the pre-survey for today's session. All right. All right, so it is 12:01. I do know that we still have some joining, so we'll give a little time for that. But as I stated before, if you could make sure that you complete the pre-survey for today's session, that's in the chat box, and I'll repost it for you all just so that everyone can see it. This in there. So my name is Trelisa Hall. I am a program manager here with the HPV Cancer-Free Texas campaign with the American Cancer Society. We are really excited to have you guys join us today. We had a great session one, or day one, led by Rachel Coughlin, and we are excited about our panel today. So if you have questions, thoughts, concerns, please use the chat box. We want to hear from you all, and we'll do our best to address those questions as we're going through the session, as well as at the very end when we have some time set aside for a Q&A specifically. Again, make sure that your name, credentials, organization, and email are in the chat box. We are, again, on day two. I'm going to introduce our panelists for today. Know that our focus for today's session is to focus on getting back on track with adolescent vaccines. We're going to share and discuss opportunities, barriers, success stories, provide advice and tools that are useful for implementing collaborative projects with schools, ISDs, school nurses that will help with assisting vaccination uptake, specifically focusing on the HPV vaccine. So that's what we're going to be talking about today. We have some great panelists. That we're going to introduce now. I'm going to give everyone a moment to introduce themselves. So we'll start with Efrat, and everyone has about 3 minutes to introduce themselves. And we'll start with Efrat, and then Essie, Kayla, and Karen.
Good afternoon, everybody. I'm Efrat Gabai. I am a senior program manager at the University of Texas Health Science Center at Houston's School of Public Health, and I manage the day-to-day operations of the All for Them vaccination initiative funded by the Cancer Prevention and Research Institute of Texas. We have been implementing All for Them for the past 4 years. We're entering our 5th academic year, and the goal of the project is to increase HPV vaccination among middle schools. We've expanded that to high schools in multiple districts across the state of Texas, and we are doing social marketing and education with parents around HPV vaccination and normalizing HPV vaccine as part of routine healthcare. We implement with a number of healthcare provider partners free comprehensive immunization clinics, in the schools. And we are also about to launch in partnership with the Texas School Nurses Organization, which of course Karen is representing them today, and Texas Pediatric Society. We're about to launch our statewide continuing nursing education course. So if any of you are school nurses, I'm happy to provide that information to you all once we launch. So that's a little bit about our project. We've had some really great success in the percentage of parents who are endorsing and consenting for their children to receive HPV vaccine in our clinics. We're at over 95% overall, and we're just really excited to share more about the project.